if I traded it all, if I gave it all.
So welcome back, everyone. My next newbies. I got with me more newbies, and we are live on Facebook. So hi to everybody out there. Like us, follow us. We're going to share the show afterwards. I have with me Scott Woofenden, if I said that correctly, and he's the owner of ePain. He also has with him Jason Chapman, attorney with ePain. You got to tell everybody a little bit about yourselves, what you do. Obviously, pain. A lot of people out there are in it. So let's talk a little bit about yourself, and thank you for being here. We're going to open up the lines to the audience, too, for people to call in if they want and have questions. But for right now, let's talk about you.
Yeah, ePain, specifically, you know, one
You got to come right up.
one in 5 Americans deal with chronic pain, and so ePain is a company trying to meet the needs of those patients. We specifically focus on those patients who have struggled or failed with other treatments, whether it be surgery, physical therapies, injections. They just haven't worked for them, and they tend to then rely on medication. And so we try to meet their needs by providing them with the medications they need to be able to function and to do the things that they require of them on a day-to-day basis. We, have tried, the struggles that a lot of our patients have is that they struggle with some of the stereotypes that they've received for chronic pain, whether that be with the opioid epidemic that started, and how they've gotten kind of pulled into some of the addictions and some of the stereotypes related to the opioid epidemic. They've also, with the government trying to help with that epidemic, the CDC in 2016 passed some legislation that limited or gave guidelines to providers to help manage these patients. And with that, patients have had struggled to gain access to providers that will provide these medications to manage their pain. ePain is one of those companies that is trying to help this patient population.
Well, let's talk about that. Let's talk about the patient population that is taking those medication like that, right?
Yep.
And there's a lot of people out there. I know a lot that take medication, and they some of them are getting hooked, right? Jason, you're here, and I want to know. I wasn't so used to having the attorney with ePain. I never. What's the reason of bringing the attorney? That's what I want to know. Go ahead.
So in 2017, Governor Ducey declared a health emergency in the context of patients that were receiving opioids for chronic pain. And with that, they had created some legislation that eventually became law. It's called the Arizona Opioid Act, and they're kind of tailored on the CDC guidelines. And those guidelines are pretty comprehensive, and they're a little difficult to follow sometimes. And medical providers were faced with having to treat the patient while also trying to navigate these guidelines and comply with the act. And when this all sort of came about, Scott decided that he wanted to try and navigate these guidelines, and that's when he and I came together. And then at that point, I've tried to familiarize myself as best I can with the act, familiarize myself as best I can with the guidelines, and then we have created protocols that mirror the guidelines that we use, or that ePain uses, the providers at ePain use to manage patients that are taking pain medication.
Well, how do you do that? When they come to your office, tell us a little bit about what they can expect.
Well, we meet with them in the office initially. We try to get a comprehensive history. We try to understand, what they're struggling with, what they've done in the past, and how we can help them. The focus is on getting them a quality of life and a level of function as best we can. And we use as many other treatments as we can regarding whether it be physical therapy, whether it be massage therapy, acupuncture. But a lot of times they need an additional treatment to help them. So again, that conversation is what have you done in the past? What can we do to help? What kind of effect have you been getting from the medication that you're on? What other options are available to you? And then try to utilize those medications to help them in their quality of life.
Before you came on, you said that you do telemedicine.
Yes.
as well. And, that's awesome. I hear nothing but great things about it. Let's talk about how that works so you could work with people statewide.
Yeah.
Go ahead and talk about that.
So it's just we are trying to utilize the technology that is available to us, especially as it relates to chronic disease that needs repetitive visits, especially with the patient population that struggles with function, struggles with mobility. Utilizing telemedicine to allow a patient to remain in their home but receive the visit and the care that they need was something we thought would be important with this patient population.
Well, also, you say that afterwards that you follow up with a video conference. What's that?
So yeah, and to get to know them, we want to see them in the office. After that, they do have the option to use telemedicine and video conferencing are synonymous. Telemedicine is more the medical lingo for that video conference. And so after they've met with us, if they choose, if for either convenience sake or just for lack of transportation, they have that ability to stay in touch with us via video.
Now, their phone number to call, it's 480-559-3149. Their website is e-pain.com. They're located in Mesa at Alma School and Baseline, but certainly you can work with them even how do you say that?
Telemedicine.
Telemedicine. They will also do that as well. They do free phone consultations with people too. What I want to do is, I just say, you know what? I want to re-say your email, your website, because I think I said it wrong. I want to re-say that. It's e-pain.net. So it's e-pain.net. Make sure that you know that and check them out. One thing I want to also talk about is too is anybody out there that is in pain or knows somebody. We all know someone too that is suffering. We're going to open up the lines here. If you feel like calling in, they can answer some questions. They're happy to answer them. I know that we don't normally let people do, but we will let you right now if you'd like to call in and ask a question. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Again, it's e-pain.net. Okay, so with this telemedicine, I mean, eventually they got to come in and get to you too. Is that correct, or how does that work when they're working with you and they're in pain and you found out what their situation is? What's the next step?
Yeah, usually they do need to come in. We do need to meet with them. That's a requirement of the federal government, is that we have that kind of contact initially to properly establish their need for the treatment, to properly establish what kind of supervision we need to apply so that we can properly manage them. But after that, that we're able to manage them on a regular monthly basis via the video. So it's just a way that we can manage their care in a more convenient way.
And you do things a little differently there. So I want to talk about what you do a little bit. I want to go more narrow and deep on it if you don't mind.
Sure.
So some of the different modalities that you do, or that you offer, I should say.
Right now, we offer mostly the medication management. E-Pain is looking to broaden its scope to be able to provide other modalities that are common with chronic pain, things like physical therapy, things like injections, behavioral health. A lot of psychiatric disorders are associated with chronic pain, and so a lot of patients have trouble managing the comorbidities associated with their chronic pain. And so we're hoping to kind of be able to provide that in-house to our patients.
Can I ask you,
Yeah.
why did you call it e-pain? What was the reason?
Well, we wanted people to know that we were trying to utilize the technology out there, the telemedicine aspect. It's a technology that's starting to be used more in medicine, and so we wanted to let people know we were trying to do that.
And that's by coming on the show, you get to do that.
There you go.
Again, they will do telemedicine with everyone out there, so it's statewide that they can help you. Their phone number, as a matter of fact, people drive from all over, you said, to come to you.
Yeah, we have people from all over the state that will make that drive initially. Again, providers are scarce for this kind of treatment, and so many are willing to drive, and then it helps them out not to have to make that monthly trek.
Well, we've got our lines open here for people to call in if you want to even ask a question about your pain. Those chronic people who are in chronic pain generally, is that correct?
Yes.
So our number here is 602-277-5369. Toll free, it's 1-866-536-1100. They do free consultations. Their website is e-pain.net. Again, that phone number, it's 480-559-3149. Hang tight. We'll be back in just a second.
If I traded it all, if I gave it all away.
Welcome back, everyone. So we're talking here with Scott Woofenden. He's the owner of ePain. I love your passion and what you want to do for people who are in chronic pain, people who are suffering like this, that you are passionate about helping them, number one. I want you to kind of explain before we go on to a little bit about some of that, again, for the people that didn't hear, they're coming back after the break, about what you do there.
ePain manages chronic pain with medication when other treatment forms have not worked for a patient and they're struggling with function, they're struggling with their quality of life, and it becomes the only modality that works for them. A lot of patients in Arizona and across the country are having trouble getting this treatment because of things like the opioid epidemic and new legislation that has come out. And so we are trying to navigate that legislation in their behalf and to be able to provide this care.
Now, their website is e-pain.net. Their phone number is 480-559-3149. They do free phone consultations. They also work telemedicine with everyone. That's something that's very new, but it's very helpful to people, so they can work statewide. People drive from all over, they say, to get this because so many people are reaching to feel better, and they need help. They've gone to the furthest extent, and they just need something more, correct?
Correct.
Now, we've also got our lines open here. I know we don't have a lot of time, but we're going to let people try and call in if you want to, if you're dealing with pain. Maybe it's someone that you know, chronic pain. Call in here. Our number here is 602-277-5369. Toll free, it's 1-866-536-1100. Check them out. It's e-pain.net. One of the things that I noticed here as one of your questions is that you do not accept insurance. And why is that?
I can take that. So this patient population is unique in that they do require quite a bit of attention, and the providers have to make sure that they are following the protocols in place that mirror the CDC guidelines that we talked about earlier, and that takes time. And most patients would probably tell you that when they go and see their doctor, they're with the doctor pretty briefly. 10-15 minutes is probably pretty typical. Our typical visit lasts half an hour, 45 minutes sometimes, and our initial consultations last longer than that. And in order to give the providers that kind of flexibility with their time, we had to create sort of a payment situation that we could provide that type of a service. So we decided in order to do that we needed to take cash rather than commercial insurance or any type of insurance.
And when they do that, is that in a sense better for them?
Yes, absolutely. The providers aren't rushed. They're able to spend as much time as they need with the patients in order to find out how the patient's doing, continually reassess the goals of the patient, reassess some of the complications that they're having, and talk about kind of the plan moving forward. And this payment model allows the providers to do that.
Well, let's talk about the future of ePain. Okay, what is it that's what you're looking to to see happen?
Well, the management of chronic pain is more holistic than it is one-dimensional, and we need to be that kind of company that is multi-dimensional, meaning that we can meet the patient's needs from not only their medications, but from their psychiatric health, from their behavioral health, to their physical health as well. And I think for us to be able to provide that would be where we're going, where we're wanting to go, and where we can be of more benefit.
Let's say there's somebody out there listening to this right now, and they're either they or their son, daughter, whatever, that's in chronic pain, that's taking, let's say, opioids to help them. Mm-hmm. Would it be a good idea that they call you and talk to you and see how you can help them?
That's usually what we need to have happen. We need to find out, what they're struggling with, what they've tried in the past. We need to find out if they do have a problem with the use of those medications or if they've had that in the past. We need to make sure they have a condition that warrants this kind of medication. A lot of the abuse we've seen in the past is because providers have not done a good job of taking a correct history and diagnosing patients properly.
Well, a lot of people out there know somebody, if not yourself, who is dealing with chronic pain and is taking some sort of a medication for that. I think that it's interesting because a lot of people say, oh, they shouldn't be, but you're not necessarily saying that. You're saying we need to figure out how to make this right, correct?
Right.
I'm trying to get the whole thing.
Yeah, the CDC guidelines were developed because we didn't have a lot of direction early on, and a lot of providers were not properly paying attention to the diagnoses and the patient's problems, as well as were they having problems as they went through their treatment. It is easy to become dependent. It is easy to become addicted. It is easy to lose control. And we can help patients if we're properly monitoring the care that we're giving them. And I think in the past we didn't have that kind of monitoring, and it was easy for patients to lose that control. And I think the CDC guidelines, I think the protocols that we've produced allow us to give the oversight that's necessary to help patients not get into trouble with this kind of treatment.
When you work with a patient, you say that you give them a lot of time, and you when they come in, and they're obviously you first have to find out what their situation is and what their needs are. Do they see you a lot? How does it work?
So right now they get seen on a monthly basis, again, for the purpose of monitoring their response to treatment, monitoring their compliance with treatment, and monitoring that it's doing what it's supposed to do.
Now, you can check them out on their website. It is e-pain.net. Write this number down. I believe that, I know it's hard. It's a hard topic. It's a conversation that's kind of hard for people, too, because some people don't want them to be on the medication, right? And so they have one thought, right?
Yeah.
And then we have the others that have like your thought of, and I agree totally.
Well, if I can say, on that regard, it's always in medicine a risk to benefit proposition, and that risk to benefit is very unique to each individual. And I think for some people the risk is greater than the benefit, and they need to not be on this type of treatment. For other individuals, the benefit outweighs the risk, and we need to provide this treatment. It is not one size fits all, that everybody is going to have a problem, that everybody needs to be treated a certain way. And I think that's what the guidelines are meant to do, and that's what we're trying to do, is take that individually.
Well, Jason, do you have anything else that you want to add that you would like to, being that you're the attorney with them? And I love that you're here, because now it really brings that full circle for people out there that's listening to understand legally that this is really okay, right?
Yeah.
Yeah, I think that the key thing for us is, and patients, is that the patients can feel comfortable that we are doing this in a safe manner, and that the providers can feel comfortable that the treatment that they're providing, treatment like this, medications, in particular opioid medications, that the providers have the information that they need in order to properly assess if the treatment is working and if the patient is taking the medications as prescribed. That way, the patient's comfortable and the provider's comfortable providing what can be somewhat problematic type treatment.
Well, the only way you're going to know is finding out and having a consultation, finding out where you're at with your pain, finding out how they can assess you and see what your needs are. So that would really start with either you can go to the office, which is in Mesa at Alma School and Baseline. They can work with people telemedicine, so they do that, and that is a great way to help with people. And then, of course, they will work with you even afterwards to talk to you again. People drive all over the state to get to them. They do free phone consultations. You could check them out on their website. It is e-pain.net. Write down this number, because it may be you or someone that you know, and that's what I love about the show more than anything, is that it's informational for those people out there that are listening. So the phone number is 480-559-3149. Again, it's e-pain.net. Let's talk to again about some of the things that you're, what does the future hold for even chronic pain and all of that?
Yeah, we hope that as we get better at treating and monitoring this patient population and these types of treatments that it becomes easier for people to get care. There's less of a negative stigma, there's more providers to provide it, and that patients have greater access to it. But until we start, doing it safely and doing it in the right way, we may have problems with that. Patients may have problems with access, which is what we're seeing now.
It starts with a conversation in everything. So give them a call and let them talk to you. They will do a free consultation. Their phone number, again, it's 480-559-3149. Their website is e-pain.net. And you know what? This time you have to call them direct because our lines aren't open anymore. But anyone that's interested in any of the things that we have been giving away today, you can keep on calling at 602-277-5369. Again, write this number down. This is something that you need to talk to them about. It's an emotional kind of a conversation, but a good one. And you're here to help people out there, especially the people that might need this kind of treatment. Again, that number is 480-559-3149. Their website, again, is e-pain.net.
If I traded it